Hello, everybody. I'm Milind Desai, and I'm the director of our Hypertrophic Cardiomyopathy Center here at the Cleveland Clinic. First and foremost, congratulations to all of us, especially the patients, uh, for the HCM awareness and a lot of things that have happened in the last year. I think it is always good to recognize what we've been able to achieve together uh, so that we can do even greater things in the future. Uh, I would like to especially say 2022 was a banner year for the disease. No other time in recent memory was the spotlight more bright on hypertrophic cardiomyopathy than it was in 2022. And for good reason, for really good reason. Obviously, I am proud, and on behalf of all my colleagues at the Cleveland Clinic, I'm proud to say that we were in the thick of everything. Not only do we have the most comprehensive clinical program for HCM, that includes all aspects of clinical management, advanced imaging, the best there is, genetic testing, invasive therapies, and now there's a new kid on the block with the emergence of precision medicine. And boy, we were there in the thick of things all year long last year. Obviously, one of the most important things that we were able to do was successfully execute the Valor HCM trial, despite all the challenges thrown at us by the pandemic. We presented the data twice at American College of Cardiology and American Heart Association, essentially in advanced patients with obstructive hypertrophic cardiomyopathy. To recap, what it showed was it reduces the need for septal reduction therapy at 32 weeks in 88% patients. 100% patients at baseline needed heart surgery or septal reduction therapy. After 32 weeks, 88% patients no longer were eligible or needed, and 95% patients chose to continue on medical therapy. That's big. That's big and potentially a game changer in the field. Now, something else happened in April 2022, and that is mavacamten, the first cardiac myosin inhibitor, was FDA approved. This is the first precision therapy drug that was approved by the FDA. And that's huge. That was rolled out in the next few months. And we have now started, we have a robust program of how to treat patients with Camzyos, that is the trade name, in addition to all the other things that we will talk about. We also continue to participate in the Sequoia trial, which is testing the next-in-class aficamten, just so that our colleagues our patients with non-obstructive hypertrophic cardiomyopathy don't feel left behind. Just a couple of months ago, we have launched the Odyssey trial. Odyssey trial will test mavacamten and its efficacy in non-obstructive patients. And again, Cleveland Clinic is spearheading the trial. I am the executive study chair, and C5 Research at the Cleveland Clinic is helping execute the study. So a lot of things happening in the context of medical management of hypertrophic cardiomyopathy. Having said that, we are not losing our focus on what has worked over the years, over the decades. Septal reduction therapy. Last year, we presented data, that SPIRIT HCM study, that showed that surgical myectomy done at an expert center like the Cleveland Clinic significantly improves the quality of life in HCM patients. We published this data, but there was also a little bit of word of caution. Just a couple of weeks ago, we published data from a large Medicare registry on hypertrophic cardiomyopathy patients. We wanted to see what is the real lay of the land nationwide in the United States. What we were able to show that there is obviously a direct and inverse correlation between number of cases you do and your outcomes. The more cases you do, the more operations, procedures you do, the better your outcomes are. However, a major word of caution that we noticed was 70% of patients that had an SRT procedure in the last 5 years in the United States were performed in low volume centers. That means a lot of advocacy, a lot of better messaging, and a lot of adherence to guidelines needs to happen. Cannot underscore the importance of that. Cleveland Clinic is working with American College of Cardiology to help develop programs so that we can perform better echocardiograms, better imaging, and we are going to launch this program in the next few months where we, across the country, sonographers will be trained to better, to obtain more optimal images. Lastly, there's obviously a lot of excitement about this. A new society has been formed dealing only with hypertrophic cardiomyopathy. Something new on the horizon is gene therapy. We are launching studies, early phase studies, testing the efficacy of gene therapy in hypertrophic cardiomyopathy. This is potentially going to be a game changer in the future. So more to come in the next few years. So to summarize, on a personal level, this has been an extremely exhilarating journey in 2022 as it relates to hypertrophic cardiomyopathy. Boy, a lot of stuff has happened, but I strongly believe we are still getting started, and I sincerely thank Lisa, HCMA, and her staff for being at the forefront of helping patients and being effective advocates. We are getting started, and I congratulate everybody on where we have come so far. Thank you so much.